Is a highly contagious infection that when 10 people are put in a room with an infected person, 9 out of these 10 people will get this infection. Let us not only concentrate on black hairs and white hairs. This skin disease we are going to talk about can extremely affect your outlook and inward health. It is accompanied with severe health complications that cannot be ignored. You are watching the Lab Doctors channel on YouTube. Kindly subscribe to our channel, like our videos, share and comment. Please do not forget to hit the notification button so that anytime we upload a video, you'll be notified. In this video, I'll tell you what to do to avoid measles infection. Note that measles infection has no specific treatment. We'll be talking about risk factors of measles infection. And lastly, if you are a traveler or a tourist, you need not to skip this video. You have to watch to the end. Let's talk measles. So measles is a viral infection that is caused by a virus called Morbilli virus. It is an airborne disease which is highly contagious. It is spread through air when an infected person sneezes, coughs, breathes, or talks. So you can imagine whichever way you can get infected. When a person breathes in the particles from an infected person, he or she stands a high chance of getting measles. Now, let's look at what makes measles dangerous. Measles disease can be very dangerous. Yes, I know that we have talked about how other skin diseases are dangerous, but that of measles is 1 in a million. So the airborne droplet of measles can stay in a room for 2 hours, even after the infected person has left the room. Also, airborne droplets of measles can land on surfaces and can easily spread to other places. After looking at how dangerous measles can be, now let's look at how measles can spread. Measles can spread by sharing food or drinks with an infected person. Also, measles can spread through kissing an infected person, shaking hands with an infected person, holding hands with an infected person, hugging an infected person is another mode measles can spread. Touching contaminated surfaces, surfaces that are contaminated with measles virus, and then touching your face, your eyes, or your nose with the same hands is another mode you can contract measles infection. A pregnant woman can pass on measles to her baby through delivery or through nursing her baby. All these are modes or means measles can spread. For the mode of spread of measles, it is always good to be at the lookout for these signs: high fever, tiredness, backache cough, we have runny nose, red eyes, and most importantly, red blotchy rash that spread from your face to other part of your body. Then talking of these signs: sore throat, muscles pain, sensitivity to light, and white spots in the mouth. When you see these signs and symptoms, do not hesitate to see your health practitioner. I know someone will want to ask, is it safe to be with someone infected with measles? The answer is a big no. Measles infection is highly contagious. And so if you are with someone infected with measles, there is a high probability of you being infected. And so when 10 people are put in the room with an infected person, 9 out of these 10 people can get measles. Now, to the biggest question: who is at risk of getting measles infection? Anyone who hasn't gotten measles vaccine or anyone who hasn't been vaccinated with measles vaccine stands the high chance of getting measles infection. Also, travelers and tourists who travel to other parts of the world where measles are very common stands the higher chance of getting measles infection. Lastly, health workers. Health workers deals with numerous people from all walks of life, and some of these people could be infected with measles. So coming into direct contact with them, health workers may stand a chance of getting measles infections. So if you're a health worker, make sure you put on your PPEs. That is your personal protective equipment when you are dealing with clients. Looking at the health complications associated with measles, it can be very severe. Health complications such as encephalitis, diarrhea, dehydration, ear infection, pneumonia, and then in pregnancy, it can result into low birth weight or preterm birth. Did you know that there is no cure for measles? Oh, yeah, there is no specific cure for measles. Its signs and symptoms could only be managed, so painkillers are taken to reduce the aches, the pain, and curtail the fever. So, the best way to manage the signs and symptoms of measles is to drink plenty water. Secondly, get enough rest. Thirdly, it is very advisable for you to gargle salt water. And lastly, avoid direct harsh lights in your eyes. Now, to how measles can be prevented. Measles can only be prevented by taking measles vaccine. So get vaccinated and you are free from measles infections, most especially to travelers and tourists who move to different countries and tourist sites just for recreation and other purposes. You need to get vaccinated to prevent yourself from contracting or getting measles infections. I hope that this goes a long way to help us all and also to protect our skin and our general health. You are watching the Lab Doctors channel. Please kindly subscribe to our channel, like our videos, share and comment. Do not also forget to hit the notification button so that anytime you upload a video, you'll be notified. Till we meet again. Bye.